Substance-related and addictive disorders. Substance-related and addictive disorders represent one of the most pressing public health challenges facing our global community today. These complex conditions affect millions of individuals across all demographics, transcending boundaries of age, socioeconomic status, race, and culture. Far from being simple matters of willpower or moral failing, substance-related and addictive disorders are recognized as legitimate medical conditions that fundamentally alter brain structure and function. Understanding these disorders is essential for healthcare professionals, policymakers, families, and communities as we work together to address this multifaceted crisis. The classification of substance-related and addictive disorders encompasses a broad spectrum of conditions characterized by the problematic use of alcohol, illicit drugs, prescription medications, and other substances that lead to significant impairment in daily functioning. This category also includes behavioral addictions such as gambling disorder, which shares similar neurobiological pathways with traditional substance use disorders. The evolution of our understanding has shifted from viewing addiction as a character flaw to recognizing it as a chronic brain disease that affects the neural circuits responsible for reward, motivation, learning, and memory. Neurobiological foundations. The science behind substance-related and addictive disorders lies in their profound impact on the brain's reward system. When substances are consumed, they trigger an artificial flood of dopamine in the brain's reward circuit, particularly in the nucleus accumbens. This dopamine surge creates intense feelings of pleasure and euphoria that far exceed those produced by natural rewards like food, social interaction, or achievement. The brain interprets this as a signal that the substance is essential for survival, which begins the cycle of addiction. With repeated exposure, the brain undergoes significant neuroadaptation. It begins producing less natural dopamine and reduces the number of dopamine receptors, attempting to maintain balance in the face of artificial stimulation. This adaptation process leads to tolerance, where increasingly larger amounts of the substance are needed to achieve the same effects. Simultaneously, the brain's natural reward system becomes less responsive, making everyday pleasures feel muted and unsatisfying. The prefrontal cortex, responsible for executive decision-making and impulse control, also becomes compromised, explaining why individuals with addiction often continue using despite devastating consequences and sincere desires to stop. Clinical presentation and diagnosis. Substance-related and addictive disorders manifest through a constellation of symptoms that significantly impair an individual's ability to function in daily life. The diagnostic criteria focus on four main areas: impaired control over substance use, continued use despite social impairment, risky use patterns, and pharmacological effects including tolerance and withdrawal. Impaired control becomes evident when individuals consistently use more of a substance than intended, make unsuccessful attempts to cut back, spend considerable time obtaining or using substances, and experience intense cravings that dominate their thoughts. Social impairment represents a tragic hallmark of these disorders, as relationships deteriorate and responsibilities are neglected in favor of substance use. Individuals may fail to fulfill obligations at work, school, or home, and continue using despite interpersonal conflicts directly related to their substance use. The progression often involves abandoning previously valued activities and relationships as the substance becomes the central organizing principle of their lives. Risky use patterns include consuming substances in dangerous situations, such as while driving or operating machinery, and continuing use despite awareness of physical or psychological problems caused by the substance. Spectrum of substance-related disorders. The landscape of substance-related and addictive disorders encompasses various categories, each presenting unique challenges and health risks. Alcohol use disorder remains the most prevalent, affecting millions worldwide and carrying significant medical consequences including liver disease, cardiovascular problems, and increased cancer risk. Despite its legal status and social acceptance, alcohol can be as devastating as any illicit substance when used problematically. Opioid use disorders have reached epidemic proportions in many regions, involving both prescription pain medications and illegal substances like heroin and synthetic opioids such as fentanyl. The opioid crisis highlights the complex intersection between legitimate medical treatment and addiction development, as many individuals first encounter these substances through medical prescriptions for pain management. The high risk of fatal overdose makes opioid use disorders particularly dangerous. Stimulant use disorders involve substances like cocaine, methamphetamine, and prescription stimulants, which can cause severe cardiovascular complications, mental health issues including paranoia and psychosis, and significant cognitive impairment. Cannabis use disorder, while often minimized in public discourse, can lead to substantial functional impairment, particularly when use begins during adolescence when the brain is still developing. Each substance category presents distinct challenges requiring specialized treatment approaches and understanding of their specific effects on the body and mind. Risk factors and vulnerability. The development of substance-related and addictive disorders results from a complex interplay of genetic, environmental, and developmental factors that create individual vulnerability profiles. Genetic factors contribute approximately 40 to 60% of addiction risk, with certain genetic variations affecting how individuals metabolize substances, their sensitivity to effects, and their predisposition to developing dependence. Family history serves as a significant risk factor, operating through both genetic inheritance and environmental modeling of substance use behaviors. Environmental influences play crucial roles in both initiation and maintenance of substance use patterns. These include peer pressure, substance availability, socioeconomic stressors, exposure to trauma, and cultural attitudes toward substance use. Adverse childhood experiences, including abuse, neglect, and household dysfunction, significantly increase addiction risk by altering stress response systems and coping mechanisms. The developmental timing of first substance use is particularly critical, as adolescent brains are more vulnerable to addiction development due to ongoing neuromaturation, especially in areas responsible for decision-making and impulse control. Treatment and recovery approaches. Modern treatment for substance-related and addictive disorders has evolved into a comprehensive, evidence-based approach that addresses the multifaceted nature of these conditions. Treatment typically involves a combination of behavioral therapies, pharmacological interventions, and psychosocial support services tailored to individual needs and circumstances. The recognition that addiction is a chronic medical condition has led to treatment models that emphasize long-term management rather than expecting permanent cure from single treatment episodes. Behavioral therapies form the foundation of addiction treatment, with cognitive behavioral therapy helping individuals identify triggers and develop healthy coping strategies. Motivational interviewing enhances readiness for change by helping individuals resolve ambivalence about treatment, while contingency management provides positive reinforcement for maintaining sobriety. Family-based interventions address the systemic nature of addiction, recognizing that recovery affects entire family systems and that family support significantly improves treatment outcomes. Medication-assisted treatment has revolutionized care for certain substance use disorders, particularly opioid addiction. Medications like methadone, buprenorphine, and naltrexone can effectively reduce cravings, prevent withdrawal symptoms, and block euphoric effects of opioids. Similarly, medications for alcohol use disorder, including naltrexone and acamprosate, can support abstinence and reduce relapse risk. The integration of medication with behavioral interventions provides the most comprehensive approach to treatment. Recovery from substance-related and addictive disorders is increasingly understood as a long-term process focused on overall life improvement rather than simply abstinence from substances. Modern recovery concepts emphasize building meaningful lives, repairing relationships, developing healthy coping skills, and finding purpose and fulfillment. Peer support programs, both traditional 12-step programs and newer recovery community organizations, provide ongoing support and connection with others who understand the challenges of addiction and recovery. The future of addiction treatment lies in personalized medicine approaches that consider individual genetic, psychological, and social factors to optimize treatment selection and outcomes. Advances in neuroscience continue to reveal new targets for medication development, while digital health technologies offer innovative ways to deliver support and monitor progress. Early intervention and prevention programs, particularly those targeting adolescents and young adults, represent crucial strategies for reducing the overall burden of substance-related and addictive disorders in our communities. As stigma continues to decrease and understanding increases, more individuals are able to access the comprehensive care they need to achieve and maintain recovery.